Session 7A, Ethical Issues. In our last session, we discussed many of the nurses' responsibilities when caring for vulnerable populations around the world. Today, what we're going to do is discuss some ethical considerations that nurses must consider when searching and providing care to all populations, particularly the vulnerable. So let's look at bioethics. Bioethics is the study of the controversial ethical issues brought about by advances in biology and medicine, and many times research has to be done in order to advance care for patients. Therefore, bioethics addresses the moral and ethical issues that arise in clinical practice. A little background. Prior to 1906, when the Pure Food and Drug Administration was passed, there were no regulations regarding ethical use of human subjects in research. There were no consumer regulations, no FDA, no common rule, and no institutional review board. What follows is a brief discussion of why federal rules and regulations were established and why the IRB became necessary. So let's first look at the Belmont Report that really came out of this. The report was created by the former United States Department of Health, Education, and Welfare, which was renamed to the Health and Human Services, entitled Ethical Principles and Guidelines for the Protection of Human Subjects of Research. The report was created in April of 1979, and gets its name from the Belmont Conference where the document was drafted. The conference center, once a part of the Smithsonian Institute, is in Elridge, Maryland, which is about 10 miles south of Baltimore, and is now operated by Howard Community College. This Belmont report attempts to summarize the basic ethical principles identified by the Commission in the course of its deliberations. The report is a statement of basic ethical principles and guidelines that should assist in resolving the ethical problems that surround the conduct of research with human subjects. The three basic ethical principles and their corresponding applications as well. So these three principles, which were mandated by a 11-member national commission in the Belmont Report, are respect for others, justice, and beneficence. So this all came about because of what took place in the Nuremberg Code in 1947. It was designed to protect human subjects and install the basic principles of ethical behavior. The main thing was protect from harm and risk. Patients should have a right to withdraw from experimentation, and qualification to conduct research had to be validated. So the Declaration of Helsinki really came about. In 1947, it was founded so that they could have an international organization that was represented from many of the physicians around the world. They were from 27 different countries, and they met at First General Assembly in Paris. It created to ensure the independence of physicians and to work the highest possible standards of ethical behavior and care by physicians. The purpose was to serve humanity by endeavoring to achieve the highest international standards in medical education, medical science, medical art, and medical ethics, and healthcare of all people.